Okay, do me a favor. Take a really deep breath in. And now, let it out. Right now, without you even having to think about it, a literally massive, incredibly complex operation just took place right inside your chest. I mean, what actually happens every time you breathe? It's something we do, about 20,000 times a day? We're processing roughly 11,000 liters of air every single 24 hours. But we rarely stop to think about the intricate machinery making all of that possible, or honestly, how fragile that machinery can be. This isn't just about moving air around, it's about delivering the literal chemical fuel required for cellular respiration to every single one of your body's trillions of cells.
The exact second that air entered your nose, it was off to the races. It travels down what basically looks like an upside-down tree inside your body. It drops past the pharynx, down your windpipe or trachea, and branches out through the bronchi. And you might be wondering, why a tree structure? Well, it's all about maximizing surface area. By constantly branching into smaller and smaller airways, your lungs pack an absolutely massive surface area. We're talking roughly the size of half a tennis court, all crammed into the relatively tight space of your chest cavity. Ultimately, that air hits the alveoli. These are microscopic air sacs wrapped in tiny blood vessels right at the end of those branches. And that is the exact destination every single breath is rushing to reach.
Welcome to The Explainer. Today, we're diving into a comprehensive guide to your respiratory health. We're going to completely demystify how your lungs work, what happens when things inevitably go wrong, and most importantly, how you can protect and even rehabilitate them. Because to put this into perspective, respiratory diseases are a huge global health burden. They affect hundreds of millions of people and cause over 4 million premature deaths every single year. But here is the incredible news, and really what we're focusing on today. So many of these conditions are totally preventable or highly manageable once you actually understand the mechanics.
All right, let's dive into this. Here is our roadmap for today. First, we'll look at the mechanics of the breath. Then Section 2, when things go wrong. Section 3 is spotting the warning signs. Moving on to the fix in Section 4, treatment and rehabilitation. And finally, Section 5, protecting your lung health.
Okay, jumping right into Section 1, mechanics of the breath. Let's get a solid foundation on how a healthy respiratory system is actually supposed to work. The entire point of this system boils down to one thing: gas exchange. This is a microscopic marvel where oxygen moves from those tiny alveoli we just talked about straight into your bloodstream. And at the exact same time, carbon dioxide is pulled out of your blood to be expelled. But here's the catch. Your lungs are actually passive. They can't do this alone. They need a pump, and that pump is your diaphragm. When you inhale, this big dome-shaped muscle at the base of your chest actively contracts and flattens down. This physically increases the volume inside your chest. And it's just basic physics, right? As volume goes up, pressure drops. This creates a negative pressure vacuum that literally sucks air into your lungs from the outside. Then, when you exhale, the diaphragm just relaxes, the cavity shrinks, pressure goes up, and the carbon dioxide is smoothly pushed right back out.
Moving on to Section 2, when things go wrong. Because as beautifully designed as this whole system is, it's highly exposed to the outside world, making it really vulnerable.
Now, what's really interesting here is how we can logically group these major diseases based on where they physically attack the respiratory system. On one side, you've got airway issues. This is where conditions like asthma, COPD, or bronchiectasis hit. They cause chronic inflammation, narrow your breathing tubes, or just produce way too much mucus. It's kind of like trying to breathe through a tightly pinched straw. Then on the other side, you've got tissue and fluid issues deep inside the lungs themselves. Think of pneumonia, where the air sacs literally fill with fluid or pus, completely drowning out that gas exchange process. Or pulmonary fibrosis, where the lung tissue physically gets stiff and scared. Imagine pulmonary fibrosis like trying to blow up a balloon made of incredibly thick rubber. No matter how hard you try, it just won't expand properly.
And the triggers for these diseases are all over the map. Asthma is usually driven by environmental triggers: dust, pollen, smoke, or even just cold air sparking this sudden, severe inflammation. COPD is progressive and overwhelmingly caused by long-term smoking. Lung cancer is the uncontrolled growth of abnormal cells, again, strongly tied to smoking and environmental toxins. But then you have these acute internal crises, like a pulmonary embolism. This is a fascinating but honestly terrifying mechanical failure. Basically, a blood clot, usually starting deep in your leg, physically breaks off, travels all the way up through your heart, and violently lodges itself into the arteries of your lungs. It instantly blocks blood flow and just shuts down gas exchange in that area.
So how do you know when a symptom is just a passing cold and when it's a real threat? 2 weeks. That is a critical threshold. If you've got a persistent cough lasting more than 2 weeks, that is a massive red flag. Why exactly 2 weeks?
Well, medically speaking, your standard viral infections like everyday colds and flus typically run their course and clear up within a 10 to 14-day window. When a cough pushes past that 2-week mark, it's strongly signaling that your body is fighting something much more stubborn. Actually, that's the classic time frame associated with tuberculosis, an infectious bacterial disease that absolutely requires immediate, specialized medical treatment.
Which brings us to Section 3, spotting the warning signs. It is absolutely crucial to recognize the macroscopic symptoms that show your respiratory system is failing.
Look, a chronic cough, fatigue, mild wheezing, those are common symptoms you should definitely get checked out. But there are certain signs that scream emergency. We're talking severe difficulty breathing, sudden chest pain, coughing up blood, or a sudden collapse. I especially want to highlight sudden confusion. We tend to think of respiratory issues as strictly chest problems, right? But profound confusion happens when the brain is literally being starved of oxygen. It's a sign of total systemic failure. Also, watch out for cyanosis. If you ever see someone with bluish lips or bluish fingers, that is a physical indicator that the oxygen saturation in their blood has dropped to a dangerously low level.
Let me be incredibly clear on what the source material advises here. Do not wait. If you or someone around you experiences any of those emergency warning signs, get immediate medical help. These are not let's sleep on it and see symptoms. They are absolute medical emergencies that need life-saving intervention right then and there.
All right, Section 4, treatment and rehabilitation. Let's shift our focus to the fix. Modern medicine has some truly incredible tools to diagnose, treat, and heal our lungs.
Once doctors use diagnostic tests like CT scans or spirometry to see exactly what's mechanically wrong, the treatments get super tailored to the specific problem. For example, they might use bronchodilators. These drugs target and relax the smooth muscles wrapped around your constricted airways, rapidly opening them up. Compare that to corticosteroids, which do something completely different. They work at a cellular level to suppress a hyperactive immune response, drastically reducing inflammation and tissue swelling. Bacterial infections get hit with antibiotics, and dangerous oxygen deprivation gets treated with direct oxygen therapy. And in extreme cases, there are surgical options, ranging from removing a damaged lobe of the lung, called a lobectomy, to a full-blown lung transplant.
But medicine and surgery are really just part of the story. Our source material explicitly highlights physiotherapy and pulmonary rehabilitation as very important. It's not just taking a pill. It's a comprehensive, active program. We're talking exercise training, specialized breathing mechanics, nutritional counseling, and even psychological support. You might be thinking, nutritional counseling? For a lung issue? Well, yeah. When you have a severe respiratory disease, the sheer caloric cost of just struggling to breathe can be astronomical. Your breathing muscles are in overdrive all day long, burning through energy. That's why specialized nutrition is critical to keep the body from wasting away while you're actively working to clear those airways.
And this brilliantly illustrates how patients can physically regain their breathing efficiency using highly actionable physiotherapy techniques. First up, diaphragmatic breathing. This is consciously retraining your body to use that main breathing muscle effectively instead of relying on shallow chest breathing. Then there's pursed lip breathing. You can actually try this right now. Inhale normally through your nose for about 2 seconds, and then exhale slowly and gently through narrowed, puckered lips for 4 seconds. Doing that creates back pressure that keeps your airways open longer, letting more of that trapped, stale air flow out. There's also the huff cough technique, designed to clear thick mucus without totally exhausting the patient. And finally, early mobilization and walking. Simply getting moving safely is an absolute cornerstone of respiratory recovery. Okay, our final stretch, Section 5, protecting your lung health. Let's focus on long-term prevention and how you can empower yourself every single day.
Because, let's be honest, the absolute best treatment is always prevention. And there are straightforward, everyday choices that drastically lower your risk of these diseases. Number 1, always, is to stop smoking. Beyond that, keeping up with things like the influenza and pneumococcal vaccines prevents severe infections from ever taking hold. Basic, diligent hand hygiene stops viruses dead in their tracks. Staying away from air pollution and occupational dust is huge. And here's a big one, regular exercise. Regular aerobic exercise actually builds up your cardiovascular efficiency. It trains your heart to pump better and your muscles to extract oxygen from your blood way more efficiently. So your lungs literally don't have to work as hard to keep you going.
So this naturally brings up a really vital question we hear all the time. Can damaged lungs actually heal? Well, the answer is kind of nuanced. While conditions like COPD or pulmonary fibrosis are progressive, meaning the physical scarring to the lung tissue can't be completely undone, the prognosis is definitely not hopeless. And that's all thanks to your body's amazing compensatory mechanisms. With early diagnosis, quitting smoking immediately, and strictly sticking to pulmonary rehab, you can train your body to adapt. You literally teach your respiratory system to use its remaining healthy lung tissue way more efficiently to make up the difference. You optimize your diaphragm, you strengthen your accessory muscles, and you can totally transform how you feel on a daily basis.
I want to leave you with this final, powerful message straight from our source text. Understanding the causes, recognizing symptoms early, seeking timely medical care, quitting smoking, maintaining a healthy lifestyle, and participating in pulmonary rehabilitation can protect lung health, improve quality of life, and save lives. Your breath is quite literally your life force. Every single one of those 20,000 breaths you're going to take today is a gift. So the ultimate question is, what steps will you take today to protect your lungs for tomorrow? Because every single breath is a fresh start, a metabolic reset, and a chance to fuel your future. Take a deep breath in, let it out, and take care of yourself.